Cứ mỗi buổi sáng, công việc của tôi là phải dậy thật sớm, chạy ra chợ mua thuốc. Đối với một chủ tiệm thuốc nhỏ lẻ như tôi, thì tìm được cái nguồn thuốc ổn định với giá tốt là một điều khá xa xỉ. Trước khi tôi bước vào nghề đã có khu chợ này rồi, không điều hòa, hàng hóa tấp nập vậy chứ không phải muốn mua là mua được.
Nhưng mà mình có cái loại này không? Cái loại
Bản thân mình luôn muốn phục vụ tốt nhất cho khách hàng, nhưng không phải lúc nào thuốc cũng có sẵn, và không phải khách hàng nào cũng sẵn sàng chi trả cho những loại thuốc đắt tiền.
Thôi chắc cho anh loại của Việt Nam đi.
Còn về phía nhà cung cấp trung gian truyền thống, đôi khi lại không đáp ứng kịp thời bởi thời gian giao hàng lâu này, giá cả chính sách thì không thông tin kịp thời cho nhà thuốc, tiến giao hàng thì đôi khi cứng nhắc, là tuần giao chỉ 1 đến 2 lần.
Currently, our sales team mainly focus on hospital channel, and we don't have a dedicated team for pharmacy channel yet. Penetration and development of pharmacy channel is a big challenge for us in terms of the people cost. Besides human resource management, training and sales implementations is also a big challenge for us at the moment. On the other hand, when our products distribute via the intermediaries in wholesaler markets, we also have some concerns about the quality control during distribution and storage.
Around 30 or 40 years back, many of the manufacturing companies in developing part of the world were underdeveloped. Some of the weaknesses this manufacturing companies had was a lack of proper distribution systems in their own organizations. This led to scarcity of products in many of the cities in the developed part of the world. So simple solution for this problem was to have a wholesale market or wholesalers in major cities. And these wholesale markets came up in many important cities throughout developed market, especially in Vietnam, Cambodia, Thailand, India. In these countries, these wholesale markets have been seen very commonly. Now, these wholesale markets served the short-term purpose of making the products available at the right time, at the right place. Many of the people or many of the pharmacies from the villages used to come to cities, to this wholesale market, and used to buy the products. But over a period of time, these pharmaceutical wholesale markets themselves became a weakness or a weak link in the entire system. Now, apart from these weaknesses, some of the weakness was seen recently during the COVID pandemic, when it was seen that these wholesale markets were heavily dependent on the human factor. During pandemic, unfortunately, many of the wholesalers could not operate, leading to the scarcity of essential products, and it led to less number of products in the hospitals or in the villages. Now these problems should not come again and again, and the solution for such type of weakness to solve these problems is to have modern technology-based solutions where there is a price transparency, where there is an overall efficiency, and the weaknesses of current wholesale systems are reduced. So it has been seen, or it has been strongly believed, that the e-commerce solutions with the help of modern technology can really solve the current weaknesses in the system of pharmaceutical distribution.
Buymed was founded in 2018 to distribute medicines online using service name tuxi.vn. We are the first e-commerce website exclusive for pharmacy, clinic, and hospital. By 2021, Buymed had distributed over 15,000 products to over 30,000 pharmacy, clinic, hospital across Vietnam. Logistics and fulfillment is the core business that Buymed invested in. We continue to expand and upgrade our fulfillment and logistics system. Our fulfillment and logistics is fully licensed with GSP and GDP. From 2022, Buymed will expand customer base to clinics, hospital, dentistry, cosmetics, spa, as well as international markets like Cambodia, Thailand, Malaysia, using technology and the knowledge that we built in Vietnam for the past 4 years. Our vision is become the largest pharmaceutical and healthcare e-commerce platform in Southeast Asia. We are using technology and new business model to eliminate inefficiencies and fragmentation in healthcare in Southeast Asia.
My name is Peter Nguyen. I am co-founder and chief strategy officer at Buymed, also known as Tuxi.vn in Vietnam. I started my career as a consultant and I moved to Vietnam to start consulting in Southeast Asia. During my time as a consultant, that's when I actually met Hoang, my co-founder. We consulted together for roughly about 5 years together, and we did a lot of projects together. We consulted on a lot of pharmaceutical projects, a lot of medical device projects for the healthcare industry. And during that time, that's when we really got to understand how healthcare actually works in developing markets and Southeast Asia. We went on projects in Indonesia, Vietnam, Philippines, Thailand, China, and we learned firsthand that the pharmaceutical and healthcare industry is still incredibly fragmented. There's a lot of inefficiencies that if you built a startup around and you really focus on solving those pain points, you can capture a lot of value. The market for healthcare and pharmaceuticals outside of cities like Hanoi and Ho Chi Minh City is incredibly big. The problem is that fulfillment and logistics to those markets are incredibly difficult. What we built at Tuxi.vn is a fulfillment and logistics network that can deliver medicine to every village and township all over Vietnam. And we're looking to build that for other markets in Southeast Asia. And as an aggregate, those markets are actually much bigger than Tier 1 and Tier 2 cities, the urban cities in Southeast Asia. By solving that problem, that's how you solve healthcare. And by solving healthcare, that's how you make Southeast Asia a lot better.
What first comes to mind is that they will no longer have to find drugs. The pharmacist will less likely have to offer substitute to the doctor's prescription. There are also more choice offered. Besides the brand name product, the pharmacist will see other available generic with transparent pricing. We believe the path to a better and sustainable future begins when everyone has universal access to affordable and quality healthcare. When people don't have to worry about medical bills, they can maximize their contribution to the society. We strongly believe that such a future cannot exist without better technology and more involvement from healthcare stakeholders. At Buymed, we're building marketplace and logistic retail solution to become the health ecosystem to fulfill this vision.
Tuxi offers two types of cooperation, which is trading, direct sales, and marketplace seller consignment. At the moment, seller consignment only share 13% GMV of the whole platform, but our plan is to increase the GMV to 42% by the end of 2025. And this transformation is not only for Tuxi, but it's a transformation for the whole healthcare supply chain. And we hope that Seller Center can work as a solution for suppliers and manufacturers to be closer with their downstream customer, including but not limited to pharmacies, clinics, dental care, and skin health. We provide the data analysis related to legal, logistic, and financial that help our clients to have more insight into the customer needs, also the market information, to support them build a digital-first branding where they can have a clear picture of their demographic before they release any new product.
Sau khi sử dụng dịch vụ của Buymed, tôi nhận thấy danh mục sản phẩm đa dạng,
Chất lượng đảm bảo, giá cả và chính sách rõ ràng và minh bạch.
thời gian giao hàng linh hoạt. Từ đó, nhà thuốc rất tin tưởng và hài lòng với dịch vụ của Buymed.
Bây giờ chỉ cần đặt hàng từ 1,5 triệu đến 2 triệu là Buymed sẽ giao tận nơi luôn.